Hey everybody, it's Dr. Osborne with Pick Dr. Osborne's Brain. Welcome to the show tonight. We're back every Monday night, 6 p.m. Central Standard Time. So if this is your first go round and you want more, mark your calendars for next week as well. Tonight we've got an interesting topic of conversation. It's all about gluten sensitivity tonight, and particularly, can you heal gluten sensitivity? Can gluten sensitivity be cured or healed? That's what we're going to be diving into. But before we do, let me do some homework or some housekeeping, if you will. Let me know if you can hear me. I want to know, one, that you can hear me. Type a 1 in the comments feed if you can hear me. Just type in a 1. And also let me know where you're from in the world. I like to know where my audience is tuning in from. So let me know where you're from in the world, and make sure too, if you've got questions, that you go ahead and get those typed in early. We're going to answer as many as we can as the show goes on tonight, but I'm only going to take what I can take. In essence, if you come in late with a question, I might not get to it. So go ahead and start typing your questions in now. So again, 1, if you can hear me, let me know where you're from, and then number 3, type in your questions if you've got them. Again, tonight's all about gluten sensitivity. So I'm looking at my phone here just to see that you guys, just to see your responses. So we are gonna get rolling here. Phone's taking a little bit of, here we go. Okay. So looks like I'm coming in loud and clear, so let's get started tonight. So, again, gluten sensitivity. Can it be healed? Can it be cured? Can you have a gluten sensitivity and do your diet well and do your diet right, and then recover from that gluten sensitivity and then start eating gluten again? That's one of the biggest questions we probably get via email at Gluten Free Society. And those of you, again, who are new to the show, if you don't know what Gluten Free Society is, glutenfreesociety.org. Make sure you go give us a visit. You can get access to our free gluten-free survival kit. You just got to give us your name and email, and we'll send that free survival kit to your inbox. So glutenfreesociety.org, sign up for the kit. But big question we get asked, gluten sensitivity, can you heal from it? Can it be healed? Can it be reversed? What can be done to reverse it? And so I'm going to start the show by hopefully not bursting anyone's bubbles too bad, but the answer, very simply, is no, not true gluten sensitivity. And what I mean by that is gluten sensitivity, well, let's define that, because you've got celiac disease, you've got gluten sensitivity, you've got gluten intolerance, you've got wheat allergy, you've got other grain-based allergies. So let's define first and foremost what gluten sensitivity is, and that way you'll understand a little bit better about why I say no to this. So let's just draw a little more here. Start with clean. Okay. So we're going to abbreviate here. Gluten sensitivity. Then you have allergy. Then you have intolerance, as being kind of the 3 areas where we get overlap and confusion in what people think about when they're thinking about gluten sensitivity. And then there's one more, and that's celiac disease. It's important that you understand that.
Hey everybody, it's Dr. Osborne with Pick Dr. Osborne's Brain. Welcome to the show tonight. We're back every Monday night, 6 p.m. Central Standard Time. So, this is your first...
Okay, so it's important that we had an audio interrupt there. It's important that you understand that gluten sensitivity can cause celiac disease. Everyone with celiac disease is gluten sensitive, but not everybody that has gluten sensitivity will develop celiac disease. So these two terms are not used interchangeably. They can't be. They're not synonyms. In essence, again, everyone with celiac disease is gluten sensitive, but not everybody with gluten sensitivity will develop celiac disease. Now, can celiac disease be healed? It can be healed. And how do we heal celiac disease? Well, we've got to go on a gluten-free diet. So in order to heal from celiac disease, you've got to go on a gluten-free diet. Now, if you heal the celiac damage by going on a gluten-free diet, can you then start eating gluten again because your gut is healed? The answer is yes, but if you do, you're going to end right back up with the celiac damage. So again, understand that if you're celiac, you can heal the damage from the celiac by going gluten-free, but you cannot start eating gluten again once you've healed that damage because you're just going to recreate the damage if you do. Think of it kind of like diabetes. If you're diabetic and you quit eating sugar and you start exercising, and then your diabetes gets under control and you control it well, and then you want to start eating sugar and not exercising again, what's going to happen? The diabetes is going to come back. So I want you, those of you who have a diagnosis of celiac disease, to understand that you don't just heal your gut and get to start eating gluten again. That's not how it works. You have to keep gluten out of your diet indefinitely. Now, there's also allergy and intolerance. So let's kind of define what these mean. An allergy is really defined as an immune response. And so most people, when they think of an allergy, they think of an acute allergy, also known as an IgE response. And so this would not, there's actually no such thing as gluten allergy, because gluten allergy in and of itself really is oftentimes mistaken as a wheat allergy. So they're not the same thing. Remember, wheat is a type of grain. Gluten is a type of protein found in all grain, whereas wheat is just one type of grain. So a person can be acutely allergic to wheat, acutely allergic to corn or barley or rye or oats or rice or any of the other grains, but it doesn't necessarily, just because they're allergic doesn't necessarily mean they have gluten sensitivity. In other words, you can have a gluten sensitivity, you can also have an allergy. They're not necessarily the same thing. You can actually have both. You can be gluten sensitive and you can also have allergies. So you could be gluten sensitive but also be allergic to wheat. You could be gluten sensitive but also be allergic to corn. In essence, you're entitled to more than one problem here. That's part of the take-home message. But an allergy is definitionally different than gluten sensitivity. So again, we're going to define gluten sensitivity here in just a minute, so bear with me. So an allergy is an immune response typically measured as a result of a doctor running an IgE test. This is either a skin prick test or a blood test that doctors will commonly run. The problem is they don't run the allergy test for gluten per se. They run that allergy test for individual food items or for individual environmental items. So if you've ever been and you've had this testing done, as a matter of fact, let's just poll the audience. How many of you here listening tonight have had patch test, skin patch test allergy, or had your blood drawn and had the doctor measure IgE? Again, this is typically done only for environmental or food-based substances. So for example, commonly the doctors will measure an IgE and they'll measure for wheat, or they'll measure for dairy, or for soy, or for some basic food or food item. They'll also do environmental, so they'll measure for things like dander and for oak pollen or for ragweed. So again, environmental, outdoor, outside types of allergies. And so that's what's classically defined as an allergy. Understand that it's what I'm talking about here is acute allergies, because there's another type of allergy that is referred to as a delayed allergy, and it's not the same thing. They can't even really, they shouldn't even really be put in the same category. They're different enough that they shouldn't be considered to be in the same category. Whereas, that's an A. Whereas a delayed allergy, the window of reaction for an acute allergy is 0 minutes to 3 hours, meaning a person has one of these types of acute responses when they eat the food. They usually will have heart racing, sweating, heart palpitations, breaking out in hives, their lips might swell, the throat might constrict, they might have watery, teary, itchy eyes, they might start sneezing or coughing. Those are acute symptoms. Usually with 0 minutes or 3 hours, up to 3 hours, that's going to be classified oftentimes as acute, whereas delayed is 3 hours to 3 weeks. And so again, this is still not the same thing as a sensitivity. This is just a delayed allergy response. So we've got this much broader, much longer window. So if those of you out there that are listening are doing like a food diet history, or you're keeping like an elimination diet, it can be very tricky. and very challenging to navigate this 3 hour to 3 weeks window of whether or not you're reacting because of something you ate last week or because of something you ate within the last meal. So food elimination diets work really, really well for identifying acute reactions, but they work horribly for trying to identify a delayed reaction. So again, allergies can be delayed, allergies can be acute. If you really want to differentiate the difference, you have to have your doctor measure them both. If they're not measuring them both, then what ends up happening is you get this very confusing report. You potentially eliminate the foods that they were testing you for and you don't feel any better because you have delayed allergies that weren't tested for, so you're missing part of that equation. That's what happens to a lot of people that actually come to see us at Origins Healthcare. So again, delayed 3 hours to 3 weeks. It's a type of allergic response, but it's a delayed response. So again, an allergy is an immune response, whether it happens immediately or whether it happens in a delayed fashion, it's still an immune response. So there's parts of the immune system that are viewing that food or that item as an enemy of you and mounting an immune response or an immune attack. Then we have the last one here, which is the intolerance. Now, an intolerance is more to do with an inability to digest. It's not an immune response. It's not an immune reaction. So we get this, you've ever heard of somebody with a dairy intolerance or a lactose intolerance where they eat it and they get gas and they get bloating. It's because they can't digest it. So what's happening is that food item ferments in the GI tract because the bacteria start trying to digest it for you, and that creates the byproduct of a lot of gas and bloating and discomfort. It can cause diarrhea. So intolerances are not the same thing. They are the capacity or the incapacity or inability to digest the food. And the most common talked about food intolerance is actually a dairy or a lactose intolerance. It's the sugar found in dairy. It's called lactose that people have a hard time or can have a hard time digesting. Now, can a person be gluten intolerant? Sure they can. They can have a hard time digesting gluten. Is gluten a protein that is challenging and very difficult to digest? Yes, it can. So a person can be intolerant to gluten, and they can also be sensitive to gluten at the same time. Again, the issue here is differentiating, right, whether or not a person just has a temporary intolerance. Intolerances can be temporary because of, in essence, what can cause an intolerance? Damage to the GI tract. So what happens a lot of times is gluten sensitivity damages the GI tract, and that leads to the cells in the GI tract not being able to properly produce enough digestive enzymes to be able to break certain foods down. And so a person can become intolerant to a lot of different foods. This is actually what we commonly see with FODMAPs. People that actually do better on a FODMAP diet or a low FODMAP diet is because they are, oftentimes their history is that they're gluten sensitive. They just don't know it. They've created over years, they've created tons of GI damage. That GI damage has led to damaged capacity to break down foods and digest those foods, and so those foods sit in the gut and they ferment and they rot and they putrefy and they create side effects that are horrendous. Lots of gas, lots of bloating, symptoms like irritable bowel syndrome. So an intolerance, not the same thing as a sensitivity, but a sensitivity can cause an intolerance. So hopefully you guys are sticking with me. Let's see here. All right, we got questions coming in. So Eddie is saying, would like to know if I fall off the wagon once with a little soy sauce and an eighth of a roll. An eighth, Eddie, why not just go all the way? No, I'm just kidding. Could it make my wrist joints ache terribly a few days later? The answer, if you're gluten sensitive, yeah, I can. I don't recommend falling off the wagon. Not even 1/8 of the wagon. I would say if you're going to fall off the wagon, like dive off the wagon and at least enjoy that dive. No, I'm kidding, Eddie. Don't do that. Look, if you eat one breadcrumb of gluten, one breadcrumb can cause inflammation or damage for people up to 2 months. So when you eat that eighth of a roll or that soy sauce, then by the way, those of you who don't know, soy sauce, number one ingredient in 99% of soy sauces that are produced is wheat. So again, wheat contains gluten. For those of you who are gluten sensitive, one breadcrumb is enough to create inflammatory damage for up to 2 months. And that's been proven in a number of research studies. That number, that 20 parts per million number that you might see on a food label is what this is referring to. That breadcrumb is the size of 20 parts per million, or also equivalent to a drop of water in a gallon of water. So it doesn't take much to create a problem for a person if you're cheating frequently. So if you travel a lot, you're on the gluten-free diet, you're gluten sensitive, and you travel a lot, you eat out a lot, you're going to restaurants, you run the risk of getting that one breadcrumb. You run a really high risk of getting that breadcrumb and keeping yourself in a constant state of perpetual inflammatory issues that you just won't respond really well. And a lot of people that say they've gone on a gluten-free diet, but they really haven't done it to the extent that they should, and they don't feel better, but they think they've tried a gluten-free diet and they didn't really respond. You've got to dial this part in. If you're not dialing this part in, you're really not truly gluten-free. You've got to get gluten-free to a great degree. Now, everybody makes mistakes. That's not what I'm talking about. We can recover from mistakes, but it's repetitive, purposeful behavior that leads to chronic exposure where people get into trouble. So, good question, Eddie. Let's see here. We knocked that one out. All right, let's see here. So again, those of you who are just tuning in, new to the show, let me know where you're from. Let me know where you're from. I like to know where my audience is from. We got Marianne from Colorado. And Leela, you're not telling me where you're from, but hello back to you, Leela. And we got Laurie Parker, and we got Patrice from Great Britain. Thank you for joining us tonight all the way from across the pond. Hey, we got Tracy from Sienna Plantation, which is just in my backyard over here. Welcome to the show. We got Patsy from California. We got Donna from Sugarland. Let's see here. Okay, you guys are not telling me where you're from. Come on now, you know the rules. This is the game. You got to play my game. You have to entertain me so that I can entertain you. We got Mary Corbin from Sugarland, and we've got Jamie from Michigan, a Michigander. I've never heard Michigander. I've never said Michigander. That's a first. Working in Chicago this week. Welcome. Peruse from Los Angeles. Hi. And Corinne, we've got Corinne. Patrice. So intolerance, can it cause diverticular disease? So can an intolerance cause, intolerance, which is an inability to digest, can that cause an area in the intestine? So if this is kind of the tube of the intestine, what happens is we can get little microscopic outpouchings. And those are sometimes referred to as diverticuli, or diverticulosis if they're not inflamed, diverticulitis if they are inflamed. Can this cause that? It can't directly. It's more of an indirect response. So what I mean by that is when you don't digest the food, this leads to a bacterial or fungal feeding frenzy. So the bacteria or the yeast within you are now eating this food for you. They're trying to break it down for you. And sometimes these guys will create byproducts that can be toxic and can create that inflammation leading to that weakening or that damage to the intestinal lining. So to answer your question, indirectly this can happen, but not directly. In essence, this is an inflammatory process that occurs, and intolerance is technically not an inflammatory process, but it can lead to inflammation. But in and of itself, it's just an inability to digest, typically through digestive enzyme deficiency. So a person doesn't have adequate quantities of digestive enzymes. So again, let's see here. Let's see how many of you are playing by my rules. Elisa says, came back somewhat sensitive to gluten. The doctor said not to worry about it. So let's define what that means, right? We're running out of room. What does somewhat sensitive to gluten mean? It's kind of a no man's term. What was that term I saw? I had a client this morning that came in and the doctor, well, let's use this term too because it's just as made up and it's just as good. There's a person I saw earlier this morning and they had a transient gluten sensitivity. So I've heard, heard some doctors say some crazy things. I think these two take the cake for today anyway, for this, maybe even for the month. You can't be somewhat gluten sensitive and you can't be transiently gluten sensitive. If you're gluten sensitive, again, hold on to the end of the show. I'm not going to reveal it until the end, so you got to stick with me all the way through. We're going to talk about what gluten sensitivity is, the true definition. But you cannot be somewhat gluten sensitive. That's like somewhat being pregnant. You either are pregnant or you're not pregnant. There's no kind of, maybe, kind of, or sort of. Same thing, transient gluten sensitivity doesn't exist. You're not transiently gluten sensitive. So if your doctor said you're somewhat sensitive, what was that based on? Number one, was it based on any type of testing, or was it based on just an opinion, right? And everybody's entitled to an opinion. That just, again, but an opinion doesn't make it fact. So you can't be somewhat gluten sensitive, to answer your question. So I would maybe look for a new doctor, or maybe look to have a different conversation with that doctor. Okay. Oh, we got Kelly. Kelly is watching. I know Kelly's from Sugarland. Come on, guys, you got to tell me where you're from. I'm not getting the feedback that I want to get here. Okay. So I'm going to finish up talking about where we were at. So we were over here at inability to digest. So there's a lot of things that can cause an intolerance. One of them is the damage from gluten sensitivity. Remember, GI damage can lead to damage of the intestinal brush border where you make a lot of your digestive enzymes. But there are a couple of other areas where we'll see people develop intolerance. Remember that the GI tract itself is not the only place that we produce digestive enzymes. The other place that we produce digestive enzymes, or the other organ we should say, is your pancreas. Your pancreas is also responsible for producing digestive enzymes. And so if you've got an inflammatory pancreatic disorder, aka pancreatitis, if you've got a history of pancreatitis or you've ever been diagnosed with pancreatitis, there's two kinds, by the way. There's acute pancreatitis, which is extremely painful, and it lands people in the hospital. So you might find yourself in the hospital with severe pain, generally abdominal pain across the stomach area. That is a acute pancreatitis, and it can be life-threatening. So if you ever experience that, yes, you do absolutely need to get into the hospital. But there's also chronic pancreatitis, meaning it doesn't really hurt to the extreme that you find yourself in the hospital, but your pancreas is being slowly inflamed and slowly damaged. And one of the things that can cause damage to the pancreas is gluten sensitivity. But there are other things that can damage your pancreas. Sugar can damage your pancreas. Dairy for some people, dairy allergy. Other food allergies can damage the pancreas. Infections can damage the pancreas. So there are a number of different things that can lead to pancreatic incapacity, or can reduce the pancreas's ability to generate enzymes. Remember, the pancreas makes lipase and amylase. These are digestive enzymes. Lipase helps you digest fat. Amylase helps you digest carbohydrates. So if you end up in a point where your amylase levels are low, that can lead to the inability to digest foods like FODMAPs. FODMAPs are basically, they're carbohydrate-based foods. And so if you don't have adequate quantities of digestive enzyme for carbohydrate, you can actually become intolerant to the FODMAPs. You can become intolerant to other types of carbohydrates. Lipase digests fat, so you can become, some people, they eat a lot of fat and they don't do well with it. It sits in their gut and it doesn't digest very well because they don't have the digestive enzyme capacity to break it down. So some people become intolerant to high-fat foods, or to food groups that contain a lot of fat. I've seen people who couldn't eat an avocado because they weren't producing adequate lipase, or they couldn't eat coconut oil because they were not producing adequate lipase. Remember, these are two tests, lipase and amylase, just FYI, these are tests that you can ask your doctor to measure. A lot of times you go into the doctor, they'll run some basic blood work, a complete blood count, a chemistry panel, they'll even look at like your cholesterol, your lipids. But when it comes to GI and digestive problems, you should make sure they're actually running your lipase and amylase, because if those values are too low, again, you might develop an intolerance or an incapacity to digest food as a whole, as a general rule. So again, GI damage, pancreatic damage can both lead to a food intolerance. A food intolerance is what? It's an inability to digest the food that you're eating. It is not what? An allergy, which is an immune response. So again, in summary, an allergy is an immune response, and intolerance is an inability to digest. So, what's a gluten sensitivity? Hang on, we'll get to it in just a minute. I want to check my feed here and see what we've got coming in. All right. Well, wow. It looks like the floodgates just opened up with questions and commentary. Okay, so Renee says, diagnosed with celiac at 48. Doctor says not an ounce how does one get at this age? We're about to talk about it. Hang with me, Renee. Sandy Chambers, my blood tests or results came back allergy to wheat but not gluten. Sandy from Jacksonville, Florida. Will that allergy eventually go away? Great question. So let's talk about that. Can an allergy go away? I got to make some room. So I'm going to do a little erasing here. Can an allergy go away is the question. And again, the premise of tonight's conversation is what? We're talking about, can gluten sensitivity be healed? Can a person who is gluten sensitive start eating gluten again once they've healed? And again, I'll answer that here shortly. But the question at hand, which is, can an allergy go away? There's fundamentally, as I said before, there's acute allergies and there's delayed allergies. So this is from a time framing perspective and from an immune response perspective. Generally, IgE responses that are short, they're acute. Those are histamine. Histamine, if you've ever heard of Benadryl, it's an antihistamine. And so drugs that, like leukotriene antagonists and antihistamines, like Singulair and what's the other ones? Claritin and Benadryl. Those are drugs that block the acute response. What they're doing, these drugs actually suppress your immune system. They don't fix the allergen, they just suppress your immune system so that those histamines that are being released by your immune system to deal with that allergen are being blocked so that you're asymptomatic, so that you don't have the watery, teary, itchy eyes or the runny nose or the throat, etc. But then we have delayed. And so again, this is acute, this is delayed. These are a little bit more subtle, and the chemicals that are released are not always histamine. Sometimes it's TNF-alpha, sometimes it's chemicals like leukotrienes, different types of leukotrienes. Sometimes we get things like interferon gamma, which can be released. Sometimes we get things like C-reactive protein, if your doctor's ever run that test, that high sensitivity C-reactive protein. So we'll see different kind of molecules popping up with delayed responses than we will with acute responses, and that's why you have to do different lab tests to differentiate the two. You can't do an acute allergy test and then assume you're not allergic to something, because you could still be have a delayed reaction to that food. So going back to that, so we've got time qualifications, meaning acute and delayed, but also there are different chemicals that are being secreted. But we also have what's called a true allergy versus an acquired allergy. So let's talk about that, because this is going to answer your question. Think of a true allergy as an allergy you're born with. It's not going to go away. And we all know somebody with a true allergy. It's the kid with the peanut allergy. When they get the peanuts, they end up in the hospital with an anaphylactic reaction. Their lips swell. You know, they break out in major hives all over their body, and it becomes a life-threatening situation where generally the child's mother or father carries around an EpiPen in their purse or their bag in case something happens where they get that acute exposure that could threaten their life. That's a true allergy. That's not going to go away. Most people that have these types of true allergies, we're not going to see time or better health improve the outcome of that type of reaction. That reaction is such a violent reaction and it's life-threatening, so we would never even make an attempt to try to reintroduce a food that created such a severe anaphylactic reaction that could potentially threaten somebody's life. An acquired allergy, however, is a little bit different. An acquired allergy is developed. Why do we develop acquired allergies? Well, one of the big reasons we can develop an acquired allergy has to do with, let's just draw a fancy line here, with gastrointestinal damage, GI damage. I'm going to draw you another picture. Okay, so this is somewhat of a correct or accurate representation. This is the esophagus here. This is the stomach. This is the small intestine. Okay, and the small intestine goes about 22 feet, and then it turns into the large intestine. We don't have enough space to draw that, but I want you to understand a concept here. And I know many of you have heard this concept before, but it's the concept of leaky gut. So, in a nutshell, your gut's lining is layered by cells. These cells, basically, imagine this is a tube, right? So it's a three-dimensional tube. So these cells have an anchoring protein in between them that basically keeps them from splitting apart. If these cells split apart, we get a gap in them. And it's that gap, this gap here, that's referred to as a leaky gut. So leaky, right? So if damage to the GI tract damages these proteins, these anchor proteins, and it creates a leaky gut, then what happens is now the food, this is where the acquired part comes in, the food that the person is eating leaks through the intestinal lining. Now what's right behind the intestinal wall? There's this big set of tonsils called the GALT. GALT stands for gastro-associated lymphoid tissue. Now the GALT represents about 75 up to as much as 80% of the entire immune system, and the GALT is behind the intestinal wall on purpose. It's there to prevent anything from the blood, from the gut, to breaking into the bloodstream. So it's kind of like the last guardian to prevent things from leaking into the bloodstream. However, what happens if these food proteins start leaking through into the GALT, into the gastro-associated lymphoid tissue, sometimes the GALT will start to look at that food as a foreign invader because it's leaking through. See, food proteins are supposed to politely come through the guardian. They come through the cell and they're recognized and they're tagged as friendly, and then the immune system will not attack them. But when the proteins are leaking through, they're not being tagged as friendly, so the immune system can perceive them as a threat or as an enemy. And this, ladies and gentlemen, is what we refer to as an acquired allergy. So to answer that question, you were diagnosed with a wheat allergy. Can that go away? Yes, it can, provided figure out what is creating or what's triggering this. So the only time we can eliminate an acquired allergy is we have to seal the GI tract. We have to seal the gut so that we're not basically being exposed to new food proteins on a regular basis that create a new immune response or an acquired immune response. So again, the true allergy is more anaphylactic, acute, life-threatening, can put you in the hospital. An acquired allergy tends to be more of in my experience, they tend to be more of a delayed type of response. So whereas a true is typically acute, an acquired is typically delayed, and an acquired can go away provided we fix that potential for leaky gut. And that's why, if those of you who haven't read No Grain, No Pain, there's a whole chapter in it on leaky gut, and I have this huge diagram there, I won't draw it on today, but of 11 different causes for leaky gut. A few of those, one of them is plastics. Drinking or eating out of plastic can create and can trigger leaky gut. Exercising too aggressively, so the people that exercise till they throw up, that can actually trigger leaky gut. So there's a couple things there that can trigger leaky gut. Now gluten can trigger a leaky gut too. So those people that are gluten sensitive, that's why so many of them develop leaky gut, because they're sensitive to gluten. The gluten disrupts these little proteins, creates that leaky gut, which leads to an acquired allergy response of the things that they're eating the most. So if you are gluten sensitive, you can still have a wheat allergy. Remember, you can be gluten sensitive and develop allergies of all different varieties and types and kinds. Same thing with intolerances. They're not exclusively mutual. You can, as I said before, you can be entitled to more than one problem, and oftentimes that is the case, and that's why so many people struggle to get better, because they don't have a doctor who does comprehensive evaluation and differentiates between these three sectors, and so maybe they change their diet a little, but they don't change it enough. They don't focus on what to change and in what time frame to change it, and they don't focus on the definitional differences between these. So people oftentimes end up confused. They stay on the diet, they're not on it long enough, and or they start eating things they shouldn't eat too quickly because they weren't told properly how long to avoid certain things. So again, let's see here. That is the answer to the question on wheat. Okay, I like this one. Courtney says, doctors refuse to say if I am gluten sensitive, but every time I eat gluten, my joints swell up. That's my only symptom. Well, Courtney, the best thing that you can do is if you want to have a real solid answer, is get genetic testing for gluten sensitivity. So that's the best way to determine whether or not you're gluten sensitive, and you can do that without a doctor. Actually, our foundation, Gluten Free Society, allows people to order genetic testing without a note from a doctor. So go to glutenfreesociety.org. There's a big banner across the top of the page. One of the links says genetic testing. Click that and you can learn more about genetic testing. That's what I would highly recommend that you do if you're trying to get a solid answer as to whether you're gluten sensitive versus maybe wheat allergic or corn allergic or something like that. So again, it's possible to be allergic to multiple grains, and so this may or may not change, but again, I'm going to get to this definition in a minute. I'm not going to spoil it. Okay, Angela, interstitial cystitis and need help on a gluten-free 2 weeks and interstitial cystitis diet, so I have a fairly restrictive diet. I am tall and thin. Any tips on not losing weight with these diets? Is black rice okay? I just received and started reading No Grain, No Pain. Well, great. All your answers really, I'm just kidding, Angela, not all your answers, but a lot of your answers are going to be in Chapter 7 and 8 in terms of the diet. So Chapter 7 and 8 are the 2 chapters on how to manipulate and change your diet. What is safe, what is not safe. Understand that interstitial cystitis is an autoimmune disease, and so it requires more than just a gluten-free diet. It requires a true gluten-free diet first and foremost, but then secondarily to that, there's some additional restrictions and other things that you're going to want to have looked at. It's also very common for interstitial cystitis for people with that diagnosis to have an infection, like an infection within the bladder. So you might want to have your doctor do a culture, run some UA testing, and when they do your urinalysis testing, have them hold on to the UA and do a culture of the urine, but have them hold on to it for an extended period of time. Most doctors will only hold on to a culture for a few days and then they'll throw out the specimen. You want to have them hold on to it for several weeks because sometimes you can pick up on these infections weeks after the culture. It won't grow early on in that culture. So those are tips for you if you're working with a doctor. As far as not losing weight, first of all, black rice, depending on what kind of rice. If you're talking about wild rice is not a grain and that one is safe, but black rice is not safe. So black rice, again, can be a grain, you don't want. That's technically going to be a taboo food. Okay, we're going to make some more room on the board. We're running out of space again. Okay, let's see. So the question was, why are we losing weight? Well, if you're gluten sensitive, let's just say gluten sensitivity is part of the problem, right? We're getting damage to organs. And this oftentimes is damage to digestive organs. So what are the digestive organs? Aside from the obvious, right? Quiz. If you know the digestive organs, hit me up with the answer in the feed. The first one, don't you dare put the gastrointestinal tract because that's the easy one. So I want to know, what are the other digestive organs? Answer in the feed. We're going to go ahead and put that up here. The liver is an accessory digestive organ. The pancreas is an accessory digestive organ. Your mouth, okay, what you produce in your mouth, not just the mechanical chewing action, but there's certain proteins that you make in your mouth that help with digestion. Attached to your liver is your gallbladder. Your gallbladder secretes bile, which helps you emulsify and digest and absorb fat. So these organs can get damaged. And so what happens is you're eating this gluten and these organs get damaged and then you start losing weight because you become malnourished. Now this doesn't happen for everyone. As a matter of fact, those of you listening, the vast majority of people with gluten sensitivity and celiac disease are obese, not too thin. But there's a percentage of people that actually are too thin, and so this is who I'm referring to. I'm referring to those of you who struggle with weight. So we're damaging accessory organs, creating malnourishment, maldigestion, malabsorption. Then what happens? Next step, we start losing muscle, we start losing weight, and then we have to restrict our diet. We're on this very restrictive diet where we're taking all the grain out, we're taking with interstitial cystitis, you're removing other types of foods, oxalate-based foods and other things. And so now you find yourself lacking for calories, or at least trying to find calories, right? And so now you become worried about losing weight. It's important to know, those of you who struggle with this, is that weight loss is normal. That means normal, okay, for the first month. It's very normal because what happens to a lot of people when they get their diet away from the foods that are creating the inflammatory response is they're not losing fat, they're not losing muscle with this weight loss, they're actually losing water, H2O. A lot of people are holding on to 5 to 10 to 15 pounds of inflammatory water. So the initial weight loss that scares a lot of people, especially thin people, they think, oh my gosh, I'm shrinking even more, is they're losing inflammatory water because they're changing their diet to a more anti-inflammatory diet. So they're healing, but then they get nervous about weight loss. So if the first month is creating some weight loss issue, I wouldn't worry about that. Weight loss always stabilizes after about the first month because there's several things that happen after that first month. One, you're no longer losing inflammatory water. But two, you start figuring this diet piece out. It starts to get easier. You start identifying other foods and other types of fats and other types of sources of caloric value, nutritional value that you can eat. And so you start eating more because you're learning more about what to eat and what you like within that realm of restriction that you've been put on. So again, you don't want to worry so much about the initial weight loss. You want to make sure that you're focusing more on investing time and effort into recipes, into food ideas, into things that you didn't even know existed, for certain types of vegetables, etc. And you want to start experimenting and eating more of these things to nourish yourself. So again, first month weight loss for somebody who's struggling, don't let that weight loss scare you. I've seen so many people, the problem is they get scared, and then what do they do when they get scared? They go back here. They go back and they start eating gluten again. And then what happens is they repeat the cycle. They start gaining the weight back, but they start getting the inflammation, and then they can't beat the disease that they're trying to battle because they get the fear of the weight loss. So don't let the weight loss, don't let it paralyze you, don't let it fear you, and don't let jerks around you talk about how anorexic you are. Remember, we live in a society today where it's socially acceptable for being overweight and being malnourished and being under-muscled to be the norm. And you don't want to be the norm. Remember, normal equals sick. You don't want to be normal. You want to be healthy. And it's far more unnormal in our society today, especially in the States and in industrialized countries, to be sick. So you don't want to really listen to what everyone else is saying about what is normal and what is not, because most of those people are very, very confused. Okay. Let's see here. Christian, South Carolina. Welcome, Christian. Been dealing with heartburn and constipation, and the doctor has me trying a gluten-free diet. Okay, great. That's awesome, Christian. Hopefully you got a copy of No Grain, No Pain. I don't see the question in that, so I'm going to move on. Let's see here. Courtney from Maryland. Welcome, Courtney. Janine. Does gluten sensitivity mean you will eventually develop celiac? Also, is celiac genetic? These are great questions, guys. No. Again, I'm going to restate what I said earlier. Gluten sensitivity, everybody, let's draw our celiac back. Everyone with celiac disease is gluten sensitive, but not everybody with gluten sensitivity will develop celiac disease. So it's important that you understand that celiac disease is just one type of manifestation of gluten sensitivity, meaning that gluten, for people who are gluten sensitive, they're reacting to gluten, and that reaction is an inflammatory reaction that can create damage in any tissue in the human body. We see people with gluten sensitivity that have neurological disease, that have gastrointestinal inflammation, like celiac disease, or Crohn's, or ulcerative colitis. We see people with skin disorders like vitiligo, or psoriatic skin conditions, or eczema. Or dermatitis herpetiformis is another really common one that's also associated with gluten. We see people develop autoimmune hepatitis, so liver damage. We see people develop pancreatitis, pancreatic damage. We see people develop joint pain, rheumatoid arthritis, lupus, dermatomyositis, psoriatic arthritis, spondyloarthritis. So all these different forms of autoimmune conditions have a high linkage to gluten sensitivity. So again, celiac is just one of those types of conditions that's linked to gluten sensitivity. You can have gluten sensitivity and not develop celiac disease, but develop some other form of inflammatory disease. Very important to understand that, because a lot of people think, oh, I have the lesser form of gluten sensitivity because I'm not celiac. That's not how it works. You don't have a lesser form of gluten sensitivity. You either are gluten sensitive or you're not. And if you don't react as badly to somebody over here, maybe this person over here, they eat gluten and they start having diarrhea and vomiting and they feel horrible, but maybe this person over here gets a migraine headache, and maybe this person over here has joint pain for 3 days. Which one is better and which one is worse? I would say it's relative based on somebody's opinion. Would you rather be on the toilet for 5 days, or would you rather have joint pain for 5 days? Which one is worse? Depends on who you are, right? Depends on what you think about diarrhea versus joint pain. To me, it's all bad. So we want to go back up and understand that gluten sensitivity is at the root or at the origin to celiac disease. Okay, Leela, I have celiac disease. I share kitchen with husband who eats and cooks gluten. Is cross-contamination easy to happen? What precautions? Okay, this is great, Leela. Great question. Buy a copy of No Grain, No Pain and give it to your husband. That's the best precaution, because as long as he's eating gluten in the house, you're at risk. That's my opinion. I've seen this time after time after time. Your husband could go to Subway sandwich, get him a Subway, eat that Subway, come home and give you a kiss, and guess what? You're cross-contaminated. That's 20 parts per million. That's one breadcrumb of exposure. And if you kiss your husband every day and he's eating bread every day, you're running the risk of that exposure on a regular basis. Now, your husband may hate me for saying this, and if he does, look, I'm sorry, don't shoot the messenger, but that's the reality. If you've got celiac disease, that's how serious that you're going to want to take it. That's how serious that you need to take it. If you're trying to do separate kitchens, you know, if your husband goes in there and he bakes a cake, for example, and the flour from that cake mix, it aerosolizes. It's powder. When you pour it into the bowl, poof, it's in the air. If you're walking by that, you can breathe that in. Let me share a story with you. I had a patient one time who was chronically sick, was gluten sensitive, and this patient went on a gluten-free diet. He went gluten-free, and he didn't respond at all. He wasn't feeling better. And it took us several months to figure out that he worked next door to a bakery, and they shared the same air ducts. So all the wheat flour and the other grain-based flours were going into the air, and they were being piped into his office, and every day he was just breathing in that flour. Well, we got him transferred out of that building, and he made a full recovery. I reiterate that story just because I want you to understand that cross-contamination that I talked about earlier, one breadcrumb of gluten can cause damage. I erased it, but it's up to 2 months. So, you know, I would just have a long conversation with your husband in sickness and in health. Look, support me. I need to have this diet change, and I need it to be real, and I need you to be on my team. That would be my advice. Okay. Okay, Michael, I have gluten sensitivity, but I stayed away from it, but lately I've been able to tolerate a small piece of sourdough bread smothered in butter. No, you haven't. You've been able to perceive that you're tolerating it, but gluten can create inflammatory damage. And when I define gluten sensitivity, you're going to have a much better understanding of what I mean by that. There's a whole community of people that are doing sourdough. They've whole community of people that are gluten sensitive, and they think that this, just because they're fermenting their bread with bacteria that creates sourdough, that somehow that's not going to be damaging to them. And what we're seeing is that's just not true. So if you're true, now that's the caveat, is that you're truly gluten sensitive. And again, I'm getting ready to define what that means, because you may not truly be gluten sensitive, Michael. Again, depends on how you were diagnosed. All right, Mary. Welcome, Mary, from Edmonds, Washington. Let's see here. Thank you, Sandra. That's a sweet comment. Sandra says, I wish all doctors were like you. Celiac for 12 years. I do too, Sandra. If all doctors were like me and were very, very diligent and followed up with their patients in aggressive diligence, we'd have a lot less sick people in the world. Let's see. Maria. Hi, doctor. Is there any link between Hashimoto's thyroiditis and gluten sensitivity? Alan, can you post our gluten sensitivity and hypothyroid article up in the feed for Maria? Maria, we're going to get you a really comprehensive article on that. Yes, to answer your question is yes, absolutely, there is a link between the two. Let's see here. Renee, can gastritis, inflammation of the stomach, and gastroparesis cause a leaky gut leading to celiac disease? I'm so glad you asked, Renee. It's really, truly quite the opposite. Does gluten sensitivity create gastritis and gastroparesis? It's not that those... So understand that every condition has a cause. And gastritis has a cause. Gastroparesis has a cause. So we can't define the question by saying, can those two things cause one other thing? We have to first ask the question, what caused the gastroparesis and what caused the gastritis, right? And there's a lot of things that can cause gastritis. Caffeine for some people can cause gastritis. So too much coffee, too much tea, too much high caffeine, too much chocolate. Those are things that contain. I've seen a lot of new energy drinks that are coming out that people are getting, and it's creating gastritis. H. pylori, it's a type of bacterial infection that can cause gastritis. So that's H. pylori, Helicobacter pylori. Make sure your doctor has run a test that is measuring H. pylori. Another really uncommonly discussed cause of gastroparesis particularly is mold toxins. Mycotoxin exposure, I've seen it in a number of cases, create and shut down the GI tract. So those of you who don't know what gastroparesis is, it's when the neurological message going to the gut to squeeze and to move the food through it so that you can defecate, that message is skewed and the gut just locks down and it's not properly processing. So everything just stays there and a person gets really backed up and constipated. They have to take lots of laxatives in order to have regular bowel movements. It's a horrid type of condition, but again, mold toxins can cause that. Helicobacter pylori, caffeine, just to name a few. We've got, again, go to glutenfreesociety.org if you're not already signed up for our newsletter, sign up for our newsletter, but also type in gastritis and type in that into the search engine and you'll pull up a number of different articles that might be helpful for you in understanding that. But we can't ask the question, can a condition caused by some other condition or some other situation cause a different condition, without first going backward and saying what causes the condition that we're asking to see. Because gastritis itself does not cause celiac disease. Celiac disease. And gastroparesis doesn't cause celiac disease. But celiac can be a cause of those things, but gastroparesis is not a cause for celiac disease. Gastroparesis is a symptom. It is not an entity. It is a symptom. Same thing with gastritis. It is a symptom that has a cause. Okay, and a lot of times the problem that people run into is their doctors get into this game of diagnosing symptoms as if they're their own unique freestanding entity that have no cause. So you go to the doctor and says, oh, you have gastritis, but he doesn't tell you why you have gastritis. He doesn't tell you what the cause of your gastritis is, right? And he kind of leaves you to wonder. And again, I'm not blaming or saying that's what your doctor did, but understand that what is celiac disease? Celiac disease is an autoimmune intestinal damage that's caused by something, right? Just like gastritis is an inflammatory stomach issue caused by something. Well, in this case, gluten sensitivity. So that's where we can't work backwards and say that the gluten sensitivity or that the celiac disease was caused by the gastritis. It's probably the opposite. The gastritis is present because the person's reacting to the gluten, and the gluten is what's causing the inflammation in the first place. So hopefully that leads to a little clarity from you. Okay, another question. Gabriella's asking about gluten and Hashimoto. So again, that's going to be up in the feed, Gabriella. We're going to get that link up for you. Actually, I can see it. It's already in there. Let's see here. Sharon, hello from New Zealand, all the way across the pond. Okay, can a skin condition which presents like DH still happen with a gluten sensitivity and not celiac? Absolutely it can. As a matter of fact, DH, for those of you listening, dermatitis herpetiformis. Okay, this is one of the ways gluten can cause disease. It does not have to be present with a positive celiac diagnosis. As a matter of fact, many people have the blister-like lesions, the dermatitis herpetiformis lesions on their skin, and they have a really good doctor who recognizes that blister lesion, and their good doctor says, you know what, that's dermatitis herpetiformis, or herpetiformis, you have celiac disease. In essence, it's a diagnosis by default. If you have the H, you have celiac disease, period, end of story. Remember, the lab testing to identify celiac disease can be highly misleading. A lot of people that have celiac disease, they don't know they have celiac disease because they've had a lab that was supposed to have ruled out celiac disease, but remember, the labs can yield false negative results. So just because you've been tested for celiac disease using antibodies or an intestinal biopsy, if that's come back negative, it doesn't mean you don't have celiac. It means that your lab test came back negative. And understand there's a big difference between the two. That's why we want to test for gluten sensitivity, and that the only way to do that is through genetic testing, the proper genetic testing. All right, we got Alexandria from Utah, and Karen, no question there, just gallbladder. Karen, welcome to the show. Angela, talking about, I'm going way back in the feed. So you guys were good. You were talking about accessory organs for digestion, and you guys were chiming in, gallbladder, liver. Good job, guys, or gals. What's my stand on pseudograins? Amy, I can tell that you have not read No Grain, No Pain. So go get your copy at Barnes & Noble or Amazon today, and you will read all about my stance on pseudograins. Again, those of you who are tuning in who are new to the Pick Dr. Osborne's Brain Show, I really highly encourage you all to pick up a copy of No Grain, No Pain. That's like our starting platform for knowledge base and for information. Like when you come into the show, you'll be so much more well versed on some of the nuances as we're talking, and then you won't have some of these questions like that. Not that that's a bad question, but again, I want to encourage you to get educated on the matter. Let's see here. From New Jersey, Jen, shortest version. I have had joint pain in hands for years. Do not have celiac, it turns out, but incidentally found out I have small bowel lymphoma. They say could have been there. Let's see. Boy, that's a big one. That is a short version of a long version. They say could have been there for years. No treatment at this time, but I could get gluten and joint pain is definitely better. But I cut out gluten and joint pain is better. I don't have the HLA. I don't have the, well, you don't, so this is actually incorrect, and maybe it's a typo, but you say you don't have the HLA-Q gene. It's not an HLA-Q gene. It's an HLA-DQ gene. So I can't have celiac. No, and that's, keep this in mind, okay, Jen, and pay attention to the end, because I'm going to define this for you in just a minute. If your gastro doesn't recognize gluten intolerance, fire him. If he doesn't recognize gluten intolerance, it's because he needs to go back to school. Gluten intolerance exists. Okay, Eric is asking, what are the signs of gluten sensitivity? Alan, can we put up that article on all the signs of gluten sensitivity for Alan? Tracy, I love these live webinars, super informative and helpful. Thank you, Tracy. I'm glad you love them. As a matter of fact, those of you who love these webinars, punch a 2 into the feed right now. Just let me know. Share the love and let me know that you're enjoying this, because that really is what fuels me to want to do them. So I appreciate that feedback. Yeah, Jennifer, I feel your frustration. A PA laughed when you said you were eliminating grains and said you were being extreme. Yeah, lots of docs and healthcare providers minimize it because they don't understand it. So we can't really, let's not blame them. Let's just fire them and move on. You know, it doesn't do us any good to talk bad about them. Let's just move on from their ignorance. Let's see. Janice, could burning mouth syndrome be related to gluten? Yes, it can, Janice, and something else that burning mouth syndrome can be related to is mercury toxicity. Big time symptom of what we call scalding mouth syndrome. So make sure you have, there are a couple different tests that you can ask your doctor to run. One is what's called a red blood cell mercury level, so packed red blood cells. We can look for mercury inside the red blood cell. Another really good test is what's called a pre and post provocation test. Pre and post provocation. It's a heavy metal test. It's a urine test. And what they'll do is they'll give you a chelating agent before you do this test. Now the chelating agent should be a substance called DMSA. DMSA. That is one of the best ways to get mercury. If you have it, it will pull it out of you and you'll be able to measure it. And that's what you need to do to rule that mercury out as a cause for burning mouth syndrome. And again, gluten can also cause it. And I'm going to talk here in just a minute about how to know whether or not you're gluten sensitive. Pina, you missed last week's show because we talked all about, can gluten sensitivity cause a miscarriage? Go back in our archive. If you're not subscribed to our YouTube feed, go to youtube.com/glutenology, and you could subscribe to our archives. And last week's show was all about infertility, miscarriages, can gluten cause fertility issues? So the answer to your question is yes, but go watch that episode. Let's see here. Okay, we get to lots of twos. Thank you guys, I'm loving that feedback. Okay, so we got to make some room because we got to finish this thing out. How are we doing on time? I'm running late tonight, but we're going to finish it up. I won't leave you hanging. I'm promising to give you an answer. Can gluten sensitivity be healed? Can you get rid of a gluten sensitivity? I said at the beginning of the show, no, but I didn't say why. And so, here's why. Gluten sensitivity is not a disease. This may be blowing your mind right now, and maybe it's not. Hopefully it's not. If you've read No Grain, No Pain, I know it's not blowing your mind, but gluten sensitivity is not a disease. Drowning. Is drowning a disease? No. Drowning is an example of taking your body, putting it underwater, and asking it to do something it's not designed to do, right? Drowning is genetic. You don't have gills, so therefore you're not going to go underwater and grow gills magically and start breathing oxygen out of the water. So gluten sensitivity is not a disease. It's a state of genetics. You either have the genes or you don't. And if you've had genetic testing done, and it sounds like some of you talking tonight did, you have to make sure you've had the right genetic testing done, because so many of you get the wrong genetic testing. We're looking not for HLQ genes, we're looking for HLA-DQ genes. And there's two of them. There's an alpha one and there's a beta one gene. So and what happens a lot of times in celiac disease, when they run these celiac panels looking for the genes, they're looking for subtypes of these genes called HLA-DQ8 or HLA-DQ2. But I want you to understand that 8s and 2s are associated with celiac disease, meaning if you have HLA-DQ8 or 2, then the likelihood that you can develop celiac disease is much higher, okay? But it doesn't mean that you're not gluten sensitive. You can have an HLA-DQ1 or an HLA-DQ3 gene pattern, and all of these 4 patterns are gluten sensitive patterns. So if you have these patterns, but you haven't had all these patterns looked for, you may be gluten sensitive and not know it because you haven't had the proper genetic testing. You've only had half of the genetic testing done, which again is what a lot of people, when they go to the GI doctors oftentimes will only look for 2 or 8 and won't look for 1 or 3. The lab company 23andMe that does the genetic profiles, they only look at 2s and 8s, they don't look at 1s and 3s. So you can be a negative for 2 or 8 but a positive for 1 or 3 and be gluten sensitive. And that's a big part of the problem for many people, is that they don't know that they have these particular gene patterns, and so they've been told you're not celiac, you're not going to develop celiac disease, keep on eating gluten. Why? Why? Because doctors oftentimes will call gluten sensitivity and celiac disease, and they'll use them interchangeably. In essence, they'll say, oh, celiac disease, aka gluten sensitivity. No, they're not the same thing. Just what I said earlier, everyone with celiac disease is gluten sensitive, but not everybody with gluten sensitivity is going to develop celiac disease. And many people with gluten sensitivity will develop things like RA. We've seen cases of multiple sclerosis, Hashimoto's, multiple skin diseases like dermatitis herpetiformis and vitiligo and psoriasis and eczema. So again, we could draw out lots of different arrows from gluten sensitivity, and the reason why gluten sensitivity is not a disease, it's a state of genetics. But if you have the genes for gluten sensitivity, how do we activate them? This was one of the questions that prompted the show tonight. How do you activate the genes for gluten sensitivity if you have them? How do you activate them? You eat gluten. You turn them on. Naturally, these genes will produce an inflammatory response against gluten when they're exposed to gluten. So you activate that inflammatory response that leads to these types of diseases by getting exposure. So you turn the genes on because these genes are actually protective. They don't want you to eat gluten, and they're trying to tell you not to eat gluten by creating an inflammatory response in your body and hoping that you'll listen. So when you eat gluten, you activate these HLA-DQ genes, and those HLA-DQ genes lead to an outcome that is inflammatory in nature, and oftentimes that inflammation builds over time and creates autoimmune disease. So somebody asked, I got diagnosed when I was 43 earlier. Why didn't I get diagnosed? If I've always been gluten sensitive and this is truly genetic, why didn't I get diagnosed when I was 2 or 3 or 10 or 15? Because just because you're gluten sensitive doesn't mean that you're sick tomorrow as a result of that gluten sensitivity. If you have these genes, it becomes an issue of input over time. The more input, the more gluten, the more pizza, the more beer, the more pasta, the more spaghetti, whatever it is that your gluten-based poison, the more input that you have, the more inflammation over time is created. The more inflammation over time is created, the less and less your body is capable of dealing with it as time goes on. Remember, all disease that's inflammatory in nature doesn't happen because of one minor incidence of inflammation. Our bodies are adaptive and resilient. They will adapt and be as resilient as they can be until they can't be. And it's that point of no return. It's that when your body no longer has the capacity to continue to allow the onslaught of damage coming in, That's the fundamental breaking point. That's when the organ reserve goes into the toilet. That's when the gut breaks down. That's when the skin becomes inflamed. That's when the liver goes into autoimmune state. So it's the chronic exposure over time that leads to the body's inability to continue to adapt to the damage. Let me give you an analogy that might kind of make this make better sense for you. If you've ever played that game in school, we played this game in school, it's called Knuckles, right? Where you just tapped each other's knuckles. You taking turns, right? And the first 50 times or so, no big deal. Your knuckles and your fingers were just fine, but you kept going and you kept going until somebody gave up. And what ended up happening, if you had a strong will, is the other guy's knuckles got super big and swollen and red and started getting bloody, and so did yours, right? And that's my point, is it's the repetitive damage. You can take a few hits, you can take a lot of hits, but that damage builds up, and when it builds up enough and the skin finally breaks and the blood starts coming out, now you kind of realize maybe it's time to quit playing this ludicrous game. And that's what I would say about this. When you are getting that damage, that constant, consistent exposure over time, your genes are responding appropriately by creating an inflammatory response to try to deal with this. And when the gluten finally breaks you down to the point where your body can no longer work or tolerate it, that's when your knuckle starts to bleed. That's when it's time to say, I need to look at this a little bit more seriously. Probably should get some genetic testing to get some clarity as to whether or not the gluten-free diet is absolutely the right diet to follow for the rest of your life. Because remember what we said at the beginning of the show, gluten sensitivity is not the same thing as an intolerance, and it's not the same thing as an allergy. So most doctors, when they're testing for gluten sensitivity, they don't test genetics. They test for intolerance, or they test for acute or delayed allergy. And it's not the same thing. And if you're running these types of tests and you have no clue, no idea whether or not you're truly gluten sensitive. So those of you who are on the fence, you're not quite sure, you've had some testing, but you didn't get genetic testing done. Genetic testing is how you would identify whether or not the gluten-free diet is the right move for you to make, because this will not go away. This is ingrained in the genetics, ingrained, pun intended. It's ingrained in the genetics. It doesn't go away. You can't cure it. It's not a disease. It's not something that needs to be cured. It's something that needs to be recognized and honored, and it's something that you need to appropriate your diet around so that you can become healthy, as opposed to continued bombardment on your genetics. Putting your genes in an environment that's not conducive to their survival is basically, it's food programmed suicide or food programmed deterioration of health, and you don't want that. So that's the breakdown. You cannot heal from a gluten sensitivity. It is genetic, and you can't change your genes, at least not yet. And we may come upon a point where you can. I still won't recommend that you do, because that's a whole can of worms we'll talk about on another day. Let's see here. I think I pretty much covered most of the questions. So, that being said, there's more questions, but we just don't have time. I'm already running almost 10 minutes over tonight. I want you guys, if you know somebody who thinks they might be gluten sensitive, if you know somebody who is on the fence about a gluten-free diet and they're not quite sure whether they need to, share this video with them. As a matter of fact, share this video with as many people as you know who might benefit from a gluten-free diet, because together we can help the 46 million people in the United States alone who have autoimmune disease. Remember, that's our mission. Our mission is to help 100 million people with chronic illness get better. I can't do it without your help. So do me the favor. I help you every Monday night. Make sure you're sharing this information with somebody who needs it. Make sure that you're delivering this information and putting it into the hands of loved ones, people that you care about, who this could potentially save their life or change their life. And those of you who are new to the show tonight, again, go get your copy of No Grain, No Pain, but also make sure you sign up for our freebies, glutenfreesociety.org. Go over there, pick up your gluten-free survival kit. Make sure you subscribe to our YouTube channel at youtube.com/glutenology. And sign up too for our Facebook group. We've got a couple different groups. The big one is Dr. Peter Osborne, but you can also join my support community. If you have read No Grain, No Pain, we have a special support community set up for people who have read the book, who are just there trying to help each other through an engaging and challenging time. So we'll see you next Monday. I hope your week is fantastic. This is Dr. Osborne with the Pick Dr. Osborne Brain Show, signing out. Have a great evening.